Hello, good day, everybody. Thank you so much for the opportunity to present. My name is Adam Roche from RCSI in Dublin, Ireland, and I'll be talking to you about a mixed method study we undertook to identify the core competencies required of healthcare simulation technicians, or SimTechs, as they are better known as, and will be referred to as throughout this presentation. Firstly, as a disclosure notice, we'd like to acknowledge the funding we obtain in RCSI Sim from CAE for support of education and research activities. So a quick overview of what we cover. I want to talk to you a little bit about the Sim team in RCSI where I work, a brief overview of the role of the Sim Tech, the research approach we took to elicit these competencies, and then we look at the results and discuss them in the current and future context of the Sim Tech role. Based in this building, not all of it, it's 9 stories in total, 4 of which go underground. We occupy the top 3 floors, 3, 4, and 5, totaling around 3,300 meters squared of simulation space. We're very grateful and happy to be working here because it's an absolutely fantastic facility. We have a mix of undergraduate health sciences programs in pharmacy, physio, and medicine. We also have postgraduate training happening in the centre. We are the national training body in Ireland for surgery, radiology, and emergency medicine, all of these of which have simulation components to their teaching programs. So it is busy and it is fun and it's good. Here's the Sim team in RCSI, which has grown exponentially in recent years. We've an 18 strong team now, which is a considerable increase from the 6 we started out with about 4 years ago or so. So SimTechs, they're deemed essential to the delivery of sim-based education worldwide, and summed up by Bailey et al. Here, they typically provide technological support and expertise in all operational aspects of simulation. I'll be honest with you, in reality, we do much more than that. And just to add to that, we can also be tour guides, audio-visual experts, mannequin operations specialists, butchers, educators, actors, mentors, innovators, and many, many more, to be honest. It's truly an all-encompassing profession and doesn't really have any boundaries. You can be doing anything, obviously, that is safe and above board, must be said. And really there's no job like it. It's a lot of fun. So this huge variety in tasks, the great people you get to work alongside, and the fact that you have an impact on patient safety and healthcare makes it extremely enjoyable and worthwhile. There are some issues faced with the role. I suppose there's ambiguity surrounding the role because it's relatively new and an evolving profession. Therefore, in many ways, it's still being shaped. It doesn't help that there are no 2 sim centres that are like for like. There are like a spectrum of sim centres throughout the world. Therefore, different tasks are required of SimTechs depending on the institution that they work in and the teaching programs that happen in there. This lack of clarity has made it difficult for organizations to recruit SimTechs and to recruit the right SimTechs. Then once they are recruited over a period of time due to a lack of career opportunities and progression, many of them kind of leave the field for other emerging professions. These simulation societies such as ASPE, SSH, and CSAM recognise the need to support training and professional development opportunities for SimTechs. Identifying training needs is a little bit hampered by a lack of clear understanding of the competencies required. So it is intriguing to see if there are a set of core competencies to perform successfully in the role. Yeah. We could not let the opportunity pass, however, by stating that understanding is not completely absent. Our colleagues in SimGhosts have developed a really good capabilities framework a few years ago, which outlines some of the competencies required of SimTechs. Although the exact approach isn't specified, it is available online to see. And also SSIH devised a blueprint and examination for the already competent SimTech called CHSOS, which is a certified healthcare simulation operations specialist. However, you do have to be a minimum 2 years in the role in order to undertake this certification. Again, however, the exact process around blueprint formation isn't specified. A mixed methods design incorporating the framework method in data analysis was used in error study, and this comprised 2 parts, SimTech job description assessment and semi-structured interviews with professionals in the field. So for the job description assessment, we searched using a Google Incognito browser for existing and live job descriptions with 3 specific search terms. And at the end of that process, 18 job descriptions met the inclusion criteria. We used the thematic analysis to analyze the data with the arising competencies subsequently kind of categorized into the relevant knowledge, skills, or attitude. Competencies were grouped which had different names but similar concepts. For example, troubleshooting and problem solving, but mean more or less the same thing. And we opted to use the term problem solving in this particular instance. So competencies were finally grouped under a particular domain, such as technical, clinical, and pedagogical knowledge. And that'll become a little bit more clear in a minute when we look at the quantitative data results. For the interviews procedures, we interviewed 30 participants across 3 groups, which were 10 SimTechs, 10 Sim educators, and 10 Sim Center managers, stroke directors. And we got to interview professionals from Ireland, USA, UK, Turkey, Denmark, and even Mexico, which is great to connect with so many different people, but also to get their global perspective. And again, thematic analysis was used to analyze the data. A deductive approach was taken to the coding process, and we utilized an existing framework for pharmacy technicians. And in case you're wondering why we took this particular approach, well, this profession is also relatively new and is also on an upward trajectory, which supports the ever-expanding complexities associated with kind of pharmaceutical care. And it did serve as an initial framework only. Here are a selection of the comments from our qualitative segment. From the job descriptions, medical knowledge was deemed important, as was strong organizational skills and a willingness to learn new things. And from the interviews, knowledge of medical equipment, the ability to plan ahead, and being respectful came up as important competencies. So this is a busy slide. Please don't be overwhelmed by the level of detail and also the writing, which is quite small. I hope you can read it. I had a good think about this, and it was, I think it's the only way to present this data to you. So here we have the 67 competencies that we listed as part of this research, grouped into 9 different domains across knowledge, skills, and attitudes. So we had 3 domains in knowledge, 4 in the skills, and 2 in attitudes. We also calculated the frequency of occurrence that each competency arose in each of the 2 analyses, which are visible in the job descriptions and interviews columns. And they're also ranked in order of prevalence, so we can get a top-down view of which competencies arose most frequently. That's not to say they're the most important, but it just means that they arose most frequently. We also went one step further and compared the competencies listed here with those listed as part of the SimGhost capabilities framework in order to get a better understanding of the gaps that our research would seek to fill. So each box ticked here indicates that that competency is listed in the capabilities framework, and if it's left blank, it's not in the capabilities framework. So 2 authors of that framework checked and rechecked the comparisons that we made to ensure that the process was robust. So all in all, no single SimTech will be expected to be proficient in all of these competencies. It just isn't possible. However, it does offer a good overview of what is required to be effective in the role. They say a picture paints 1,000 words, which is why we were keen to add this cartoon to the presentation, with thanks to Owen Kelleher for creating this for us. Thank you, Owen. And here are a host of competencies are evident with the SimTech multitasking, applying moulage to the mannequin whilst troubleshooting a different Sim on the telephone. Not forgetting all the while that the standard of the setups aren't compromised by carrying a standard operating procedures document in his back pocket. I do this myself. So compliance is a very important competency, which we elicited. But what's not so visible here are the other important competencies which allow this tech to get to the point where he or she is competently multitasking independently, such as remaining positive in the midst of doing many things at once under pressure, hence the smile on his face. He's also customer focused, taking a telephone call about issues with another sim in which he isn't directly involved in order to help out for the greater good. He's pouring liquid latex to simulate skin, perhaps something he hasn't done before. Therefore, he's curious. He wants to keep an open mind and willing to attempt new things for improvement's sake. He's simply taking initiative, not making a fuss, which goes back to that important positivity competency that I just alluded to. So this leads on to our next part. What does all this mean? Well, before one seeks to fill knowledge or skill gaps, a SimTech must first demonstrate can-do attitudes to build upon. You don't necessarily have to come from a medical or technical background to be good in the role. If you are not willing to learn new things, you're not self-motivated or genuinely not interested or curious about simulation activities, then the rest is completely irrelevant because it won't go very well in the role. So we talk about eliciting these competencies in the interview process at the very, very beginning, because attitudinal competencies such as these tend to be difficult to develop or foster once one commences the role, and they are crucial to the success of the SimTech and also to the teaching programs that the SimTech is involved in, most importantly. However, if a SimTech does display these important qualities, then they can build upon their knowledge and skills by attending training courses, exposure to simulation programs over time, and generally just asking questions. If you are inquisitive enough, you'll ask the questions, and that's kind of what served me well in RCSI to date. Constantly asking faculty questions, what's this, what's that, and in fairness, they're always helpful. I will answer them for you. So resourcefulness is interesting. That's why I've highlighted this one here. It doesn't appear in isolation, but typically it's probably less obvious kind of competencies as well in there as a whole. It doesn't appear in isolation, but typically builds on other skill-based competencies, again, assuming the SimTech already possesses the correct attitudes. For example, a SimTech might be a resourceful problem solver with competent maintenance skills. So there's a number of competencies in one, meaning that they resolve issues as they arise with minimal disruption to the educational activities and sometimes in a cost-effective way. So there is a need for better alignment of these competencies across job descriptions, established frameworks, and in the traditional interview process. So better alignment will also support training and educational opportunities to fulfill the SimTech role. So our findings help support constructive alignment by identifying the knowledge, skills, and attitudinal competencies that need to be developed by SimTechs. Perhaps next steps would be to look at approaches of this for the SimTech role that have been identified previously for other professions. So thank you. That's all for me. Thanks for listening. Any questions?